What causes neurotransmitters to go off kilter? Stress. Okay. So let's exactly see what happens when you have neurotransmitter imbalance. Well, here's normal. Okay, we're just going to talk about dopamine here. Okay, dopamine is created in the axon by tyrosine, and the dopamine is created, it's put into the vesicles, which are those little storage areas. If it's broken down in the axon, it's broken down by MAO. And when there's a need for dopamine, it'll be put into the synapse. It'll go, like I said before, to the receptor, then pop off and either get broken down by catechol-methyltransferase, or it'll hang out with its buddy or get reabsorbed. Okay, this is called optimal activity. If we saw it on a graph, you'd see the optimal range. You see the neurotransmitter stores are in the optimal range, and the neurotransmitter activities in the optimal range, and all is well. Stressor hits, okay? It increases the demand of neurotransmitters. And again, we're just talking dopamine, but just think about all of them, okay? The stores become depleted. Yes, we're producing it, but the stores become depleted. There's a lot of high activity. So the more activity that there is, the longer that the activity continues, there's going to be a greater demand on the neurotransmitter stores. So this is what that would look like when you encounter a stressor, okay? With a chronic stressor, the neurotransmitters simply aren't made as quickly as the demand requires. So what's going to happen at first is that you're going to have enough in the synapse, but the storage areas are going to be consistently depleting. So this is, you don't even have symptoms at this point, by the way, all right? So now the stores are kind of getting real low, but the neurotransmitter activity is still in the optimal range. This is what's called optimal looking activity. When the neurotransmitter stores become depleted, there's not enough neurotransmitter in the synapse to carry the messages. The low activities give you improper communication, hence, that's where the symptoms occur. And by the way, it's years, notice the timeline, months or years. This is when you get the symptom development. So when someone comes to you with a mood disorder, it isn't recent. Something recent may have, brought it to the forefront. Okay, but if they've been complaining of a chronic mood disorder and nobody else has been helping them, and they come to you, I want you to realize that those neurotransmitter vesicles are empty. Okay, what does a medication do? I'm going to go backwards a little bit, all right, to this optimal looking activity. What the medications do, what an SSRI does, SDRI, SNRI, is they are reuptake inhibitors. Part of the neurotransmitters volume in here is based on not only what's being put in and being broken down, but the uptake mechanism, the reuptake mechanism. What the medicines do is interfere with part of that reuptake mechanism, thereby giving you more of the target neurotransmitter in the synaptic cleft, giving you optimal looking activities. And guess what? This can hang out for a long time. Here's the thing, the medicines don't do anything to replenish the neurotransmitters. They don't even think about it. It's like, here, take the medicine, you'll be all right. And of course, when there's not enough neurotransmitters, so the reuptake mechanism gives you enough neurotransmitters, they do something really intelligent. They put you on antipsychotics. So hence, if it isn't for us looking at things from this point of view and saying, hey, we might want to give the body what it needs, okay, so it can produce its own neurotransmitters, okay, people are doomed, and I do mean doomed, to utilizing stronger and stronger medications with more and more side effects. But people, I'm also a registered nurse, okay, as well as an EMT paramedic and a whole mess of other letters and numbers next to my name. I am not anti-medicine. I am anti the stupidity. Okay, I am anti the injudicious use of medicines and the injudicious use of anything when it's done without thought, which means that you're hurting the patient. Stress accelerates the neurotransmitter turnover. said that already, didn't I? Okay. What stressors can affect that? Cell danger response are those things that will injure the cell in equal measure. So we already know about heavy metals and heat, salt, that kind of stuff. We all know about mold, fungi, bacteria, parasites, and please, in your mind, put viruses in there. I forgot. Okay, but all the psychological, emotional, and spiritual things that we face can injure the cell just as much as chronic Lyme disease. Okay, and it doesn't have to be a rape or a battle. It could be an ongoing toxic relationship. It could be a non-nurturing childhood. Okay, there are loads of spiritual things that go intergenerational and stuff that may have a contribution. It's our job, not our patients, it's our job to figure it out. Okay, so when you have a chronic cell danger response, what happens is the cells are unable to reboot their homeostatic or allostatic mechanisms. This is what causes inflammation and results in neurotransmitter imbalance, leaky gut, leaky cell, leaky brain. Sometimes we call it chronic inflammatory response syndrome, okay, which is usually associated with biotoxins. The chronic symptoms will express as mood disorders, immune dysregulation, autoimmune disease, and chronic unremitting illness and disability. It's all in a big circle, and it gets worse and worse and worse unless we intervene. Once you get to the chronic cell danger response stage, the body will simply not heal itself. This is why people with chronic Lyme disease, even being treated for years with antibiotics and rotating antibiotics, okay, still don't get better. And the common wisdom now is that Lyme disease can't be cured. Just ask somebody on the street, and if they know anything about Lyme disease, that's what they're going to tell you. And I would like to say that, I would like to say a bad word, but that's nonsense. The symptoms that you see are influenced by toxins, microbes, diet, everything we talked about. Okay, these are the things that we have control over: lifestyle, nutrients.